Now, let's proceed to our next topic, which is the OCD. So, OCD is defined as an obsessive compulsive disorder. It is defined as one of the anxiety disorder. What does it mean of O, obsession, C, compulsion? Obsession is a recurrent, unwanted thoughts or idea or image, while compulsion is a repeating act over and over again. It affects a person's abilities, lives, individual, which compelled to perform certain tasks ritually, which they have little control over stopping this syndrome. So one of the example is the fastidious attention to details, and then extremely cleanliness. Now let's go on, like what's going on. Let's take a look what's going on anatomy on in our brain, in our brain, or in a patient which has an OCD. Research found out that OCD is triggered by communication problems between the deep structure of the brain and the frontal part of the brain. What is involved on that area? So in the deepest structure is the thalamus and the striatum, and then the frontal part of the brain is the orbitofrontal cortex and the anterior cingulate cortex. So these are the four areas that is like responsible for communication. The OCD symptom is like primarily it's the OCD symptoms primarily is having a communication error on this part of the brain. Later on, I will like discuss also what's medication and what management is we need to do, or the doctor will prescribe when OCD is attacking to a person. So, by the way, in this part of the brain, it's primarily used by the inhibitor serotonin. So, let's not forget this thing. That is like very in need on this part of the brain. So, let's take a look now about the signs and symptoms. Like I said a while ago, one of the sign of symptoms is like fear of being contaminated by germs. So this is being extremely clean. Next is fear of losing control, harming yourself or the others. It generally refers to ability to provide conscious limitation or impulses or behavior. Next is like intrusive sexually, expect on violent thoughts and image. So it says that it involves on unwanted thoughts, often involve like children, formerly family member, inappropriate person that will leads into violence. Okay. Next is one of the signs and symptoms of OCD is excessive focus on religious moral ideas. This is like the person is fixates on obsession of one base religious belief. Next is like fear of losing, not having things you might need. This is what we call the hoarding disorder, which is fearing of getting rid of things. Order and symmetry idea, everything must just line up just right. So this is like excessive attention to details. Next is superstition, excessive attention to something considered lucky or unlucky. It refers to a compulsion to do the rituals over and over and over again. Okay? Next is like, let's just try to look the cause of OCD. One of the main factor of cause of OCD is the genetic hereditary factors from your genes, from mother, great grandparents. Second is the chemical and structural functional abnormalities that is going on in the brain. So it causes also like what I've said to you, like if you are having a decreased serotonin in the brain, there will be like abnormalities. I'll just like tell you later again in our medication. Okay, next is the risk factors. Okay, risk factor is like typically being involved on adolescence but may start in adulthood or childhood but become usually worsen when it's worsen with aging. Okay, so the more you are like growing old, the more you are tend to have like this kind of OCD. It's aggravate. Okay, next is like what are the managements and medication. Like what I said in panic disorder, one of the main common therapy is the CBT, okay, cognitive behavior therapy. This is serotonin reuptake inhibitor medication. So this is what I'm just telling you a while ago regarding the chemical imbalance. So, in changes in neurochemicals in serotonin, as well as the neurochemical dopamine and the glutamate, it's likely prevent the OCD. So, the more you have dopamine and glutamate, the more it will prevent the OCD. The more you have a high serotonin on your brain, the more it will alleviate the symptoms. Simple as that. Okay? So next is like augmentation therapy. So augmentation therapy, this is implemented if the SSRS, the serotonin reuptake, is failed to OCD symptoms, but at least 3 months. And next is the education and family intervention, like counseling, talk to the patient, give some attention, okay? Next is the medication, which is like, I have three medication that is like for anti-psychiatric and antidepressant, which is Zoloft, Prozac, and then the sertraline. So these are the common management that will help the OCD patients. So from therapy to medications. Thank you for listening.